Okay, hi, this is Zoya Kershigieva. I'm going to be performing the abdominal exam. We have the patient laying down, straight, flat, trying my best to have him hold the camera so that you can see the exam. Okay, so let's begin. Just position. Like that. Is that comfortable? Okay. All right, so hi, my name is Zoya Kershigieva. I'm a PA student. I'm going to be performing the abdominal exam. So we're going to start, I'm going to start with auscultating the abdomen before doing any percussion or palpation. So I'll start with just inspection for venous abnormalities. I'm looking for any masses, I'm looking for any bulging flanks. And with my tangential lighting, I'm going to pretend like I have my light here. Okay, I'm pointing at the aorta and I'm looking for the aortic pulsations, okay? So there are no visible lesions, scars, venous abnormalities, masses, bulging flanks, and the umbilicus is midline without any herniations. Okay, so now I'll be auscultating for bowel sounds in all four quadrants with the diaphragm of my stethoscope, okay? Okay. Left lower quadrant. Right lower quadrant. Okay, good. So no more active bowel sounds. Okay. All right. So in all four quadrants, and I'll be auscultating for bruits with the bell of my stethoscope on the aorta. I'm looking at the renal arteries, at the femoral, at the iliac. Okay. So so now again with the bell of my stethoscope. This is the aorta, renal arteries. Okay, actually this is, yeah, and then this is iliac. And then a little, move the camera down, a little more. Okay, this is the femoral. Okay, all right, very good. All right, so the aorta is midline. There is no aortic, renal, femoral, iliac, bruits auscultated. Now I'm going to percuss the abdomen in all four quadrants, and what I'm looking for is areas of tympany versus dullness. Okay, so right upper quadrant. Good, left upper, left lower, right lower. Very good. Okay. So the abdomen is tympanic throughout. Now I'll be palpating the abdomen in all four quadrants, starting with superficial palpation and then deep palpation. Okay, and what I'm looking for is to see if the abdomen is distended, to see if it's soft or not, and if there is any pain upon palpation. So this is going to be the superficial palpation, left upper, left lower, right lower, and we did the right upper. Now I'm gonna do deep palpation. So right upper, left lower, and right lower. Okay, very good. So the abdomen is soft, non-tender, non-distended to palpation without any abnormalities. Okay, so now I'm going to be assessing this liver span, okay, at the midclavicular line. So midclavicular line, and I'm going to start with, so this is, we're gonna percuss. So I'm just gonna ask you to hold the camera with one hand. I'm gonna need your hand here.
Which hand?
Yeah, that's fine. That's
okay.
Fine. Okay, so I'm gonna start here. Okay, place your hand right here. Good. Okay, you okay?
Camera do.
Okay, I'll hold it.
I got it.
Okay. Okay, place your finger right here. Just one finger. Good. Okay. So I'm trying to listen for dullness right here. Okay, good. So now I'm going to take my ruler. I'm just gonna take this and I'm going to measure it. Okay, very good. All right, so the liver span is 7 centimeters in the right midclavicular line. Now I'm going to palpate the liver edge in the midclavicular line. So I'm just going to ask you to take a deep breath. So point here, like this. Can you hold it?
Yes.
So take a deep breath. Inhale. Keep inhaling, take it out. Inhale again. Okay, I'm palpating for liver edge. Okay, very good. Okay, you can relax. All right, so the liver edge is smooth, palpated 1 centimeter below the right costal margin. Now I'll be palpating the spleen in the left upper quadrant, having the patient on the right lateral decubitus position. So I'm going to just ask you to turn around to the side.
All the way.
Like that, you're good. Yeah, so this is your right side, this is your left side. I need you to put this like that. Can you hold it like that? Yeah, like that, perfect. Okay, good. All right, so I'm gonna place my hand here and I'm going to palpate the spleen. Okay. Okay, very good. All right, so the spleen is non-palpable. Okay, and now I'm going to do the splenic percussion sign, looking for splenomegaly. So I'm just going to ask you to still turn to that side. Okay. All right. So let me see. All right. Just relax. Okay, so that's tympanic. Take a deep breath and hold it in. I'm looking to see if it's still tympanic. Very good. Okay, relax. All right. So no splenomegaly upon percussion. All right. So now I'll be palpating the femoral arteries, looking for upstroke and symmetry bilaterally. So I need you to just lay down straight, yeah. Point this downwards. I need this area. Like this. Okay, hold it, please. Okay, so I'm looking for the pulsations. All right, good. Okay, good. So femoral artery pulses are 2+, symmetric with good upstroke. Now I'm going to be palpating the inguinal and the femoral lymph nodes, and what I'm looking for is lymphadenopathy. So I need you to point it up again. Point it up again, up like that, this area. Okay. Relax your legs. All right, so I'm gonna go in a circular motion, femoral. Okay, looking for the lymph nodes, looking to see if there's any lymphadenopathy, and then the inguinal. Okay, so this is this way, and then this way. Okay. Okay, very good. Okay. No lymphadenopathy upon palpation of the femoral and the inguinal lymph nodes. So now I'm going to be percussing the costovertebral angles to see if there is any CVA tenderness. So I'm just going to ask you to sit up. Okay, how are we gonna do this?
What do you need?
Okay, good. Yeah. So turn this way. Like this, yeah, perfect. Right. So tell me if you have any pain.
No.
No. Okay, good. So you can lay down now. Okay, so no CVA tenderness. No, lay down like straight. Thank you. Hold it. Okay, all right. So this patient will also need a rectal exam. Now we're going to start with special tests. I'm going to start with checking for ascites, which is fluid in the abdominal cavity. I'm going to start with inspection for ascites, and then I'm going to now do the percussion in all 4 quadrants of the abdomen. Okay, so let's start with percussion again. Looking to see if there is like changes in sound. Okay, so now I'm going to be performing the shifting dullness test and also the fluid wave test. Okay, so we're going to start with the let me think 1 second. I think I'm gonna start with the shifting dullness test. So what I'm gonna do is I'm gonna percuss. Okay. So area, I'm trying to go from area from tympani to dullness. Okay, so this is my right here. Okay. So I'm gonna mark it right here, and now I want you to turn again towards me. Okay, thank you. So point it as much as you can down here, like that. Yeah. Okay. So I'm gonna be doing the same thing, just to make sure that the sound is the same. Okay, very good. Now we're going to be doing the fluid wave test. Now, lay down normally. Okay, now I need one of your hands, this one.
Okay.
Put it like this. Like that, perfect. Like, sorry. Okay. So can you hold it like that? Okay. Yeah, got it?
You got it.
But I need to see your stomach. Okay, thank you. All right, so I'm going to, you see me? Okay, I'm holding him on this side, on the right side, and I'm going to be tapping this side, looking for a fluid wave coming to the right. Okay, good. So fluid wave test is negative, and the shifting dullness test is negative. Okay, so patient has no free fluid in the abdominal cavity. So now I'm going to be checking for rebound tenderness, and I'm checking for peritoneal irritation. Okay, so, oh, relax. Okay, does that hurt?
No.
No, okay, good. All right, okay, so there's, patient has no rebound tenderness. Now I'm going to be performing the McBurney point tenderness, which is found 1/3. Point up your, let's see this part. Yeah. So it's going to be, I'm gonna pull this down, sorry. 1/3 from the umbilicus. Okay, so it's like right here. All right. So it's going to be 1/3 of the way between the anterior superior iliac spine and the umbilicus. So what I'm going to do is I'm going to press down, and then upon removal, if it's painful, then that's going to be positive. It means that something's maybe wrong with the appendix. So here we have the umbilicus, and then we have the anterior superior iliac spine, and then we're going to have 1/3 of the way is here. So I'm just going to palpate. Any pain?
No.
Okay, good. So McBurney point tenderness is absent. So now I'm going to be performing the Rothsing sign. So this is also checking for appendicitis. I will palpate the left lower quadrant, okay? And upon removal, do you feel any pain in the right side?
No.
Okay, so Rothsing sign is absent. So now I'll be performing the psoas sign, and I'm gonna ask the patient to lift their right leg against resistance. Okay, 1 second. So I'll hold it from here. Okay. So right leg, this one. Lift it against resistance. Any pain?
No.
No. Okay. Hold this. So now we're going to be performing the obturator sign. Okay. So I'm going to ask you to hold this like this. That's good. Now, yeah. So give me this leg, okay, and we're going to bend it and internally rotate it. Okay. Any pain in the right lower quadrant? No. Okay. So that was our obturator sign. So psoas sign and obturator sign were negative. Hold this, please. Okay. So now we're going to be checking for the gallbladder test. Okay. So obturator sign was absent. So now I'm going to be performing the Murphy sign. Okay. This is going to be assessing for gallbladder inflammation. I'll be palpating the right upper quadrant. Okay. So I'm going to be doing that, and I'm going to ask you to take a deep breath. If you feel any pain, then it means that McBurney point tenderness is Murphy sign is positive, and maybe the gallbladder is inflamed. Okay, so I'm just going to go right here. Any pain?
No.
Okay, very good. So Murphy's sign is negative. Okay, 1 second. You didn't take a deep breath, right? Let me try again, sorry. Take a deep breath. Does that hurt?
No.
Okay. All right, so Murphy's sign is negative.